My name is Dr. Daryl Dykes, and I'm going to discuss total hip arthroplasty. Most people that wear out a hip have groin pain. This is pain in the anterior or front part of the hip. Pain coming from the side or the back of your hip is often coming from another source, such as bursitis or degeneration of your spine, causing pain going down your leg. So this is primarily for people having severe pain in the groin. Common complaints are trying to get into and out of a car, perhaps getting into and out of a booth, pretty much trying to move the hip in any way causes severe pain in the anterior part of the hip. The solution for a total hip, if you're failing non-operative measures such as anti-inflammatories, protected weight bearing, weight loss, is a total hip arthroplasty. This is especially true once the sphericity or the roundness of the hip is lost. There are conditions such as avascular necrosis where the blood supply going to the ball of the femur is compromised, the bone gets weak, and the head will actually collapse. Once you have a flat head, the game is up for your native hip and it will need to be replaced. The beauty of a hip replacement, though, is it is extremely effective. People often have fairly prompt, complete relief of their symptoms by replacing the ball joint. The procedure is performed on both sides of the joint. You have the pelvic bone. On the hip socket side, we ream a hole into the pelvis. Say we ream that hole to 52 millimeters, and we will select a slightly larger implant, which will be press fit into that cavity. The implants that we use are a hemicircle of metal. There's rough coating on the outside of the cup. So when we insert it into the hip, it's secure immediately. We basically wedge a slightly larger cup into the hip, so it's instantaneously stable. The other part of the hip replacement is the femur. This is your thigh bone. So the top of your thigh bone, we prepare the femur by cutting off your native hip and replace it with a metal stem that goes down into the femur, and we replace the ball. Many people nowadays end up with a ceramic ball, but you can also use more traditional chrome, cobalt, steel heads as well. They both are very effective. So once the hip has been completed, you're in effect putting a new ball bearing into your hip. The reason you hurt before is the two sides of the hip joint were rubbing on each other. You have bone on bone wear, causes a great deal of pain. Once you do a total hip, let me turn it around. Once you do a total hip, the ball sits into the pelvis. If you're sitting down, the hip does something like that. You get up to walk down the street or bring your leg in and out, and you have a nice smooth surface in there, and this can be extremely effective. After the procedure, many people go home immediately after the operation. On the day of the operation, we have you get up walking with therapy, full weight on this construct in 99% of people. If the therapists tell us that you're safe to go home, you can go home, and we have home therapy come out to the house the next day to continue the therapy and any other medical care that you may need, such as removing a drain after the procedure. After the procedure, you also have a waterproof dressing on the outside, which allows immediate showering after the procedure. The main cautions after a posterior approach for a total hip is you don't want to get your leg or cross your legs, you don't want to turn your toes in, and you don't want to hyperflex the hip after the procedure. The advantage of a posterior hip is that it greatly improves foot hygiene, maintenance on your foot. With anterior hips, you cannot cross your legs like this. With a posterior hip replacement, you can cross your legs like this, which allows access to your shoe, tying shoelaces, working on your toenails, putting on socks, etc. And that is a very big advantage of a posterior hip approach. Most people come back to see us in the office approximately 2 weeks after the procedure to remove the staples. We will do a wound check at that point, take an x-ray of the hip at that time. Certainly you'd be free to come back by the office at any time before that if you felt like you had any issues with the construct. For most people, we do not do any therapy for the first 2 weeks after the procedure. The therapy is simply do not fall, use your walker, and walk. And so it's fairly simplistic with a total hip replacement. If you feel like you're a candidate for this type of operation, please feel free to contact us at our Pelham office. This is Alabama Bone and Joint Clinic. Our number is 205-621-3778. Thank you.